Tobacco and Oral Health. I'm Jenny Hooker, and I am a dental hygiene student at Georgian College. I recently had the opportunity to research the effects of tobacco on a person's oral health. As you can see in the pictures provided, tobacco can have a detrimental effect and can lead to a very unpleasing aesthetic. If you are a tobacco user or are considering using tobacco, I hope that this presentation gives you some important information that helps you make a healthier choice. During this presentation, I will be focusing on tobacco use in relation to tooth decay, periodontal disease, and oral cancer. This image is quite disturbing. When smoking a cigarette, you are putting all of these substances into your body. Not only are things like methanol, butane, and arsenic detrimental to your lungs and overall health, but they also have quite a negative effect on your oral health as well. Your mouth is the entry point for all of these ingredients, and therefore gets a potent dose of the toxicity. Before lighting up, people should consider whether or not they want all of these components of a cigarette entering their body. Tooth decay. An early sign of tooth decay is tooth discoloration. Tobacco stains the teeth, and this stain can penetrate deeply into the tissues of the tooth, including the enamel, dentin, and can even reach the roots. Many tobacco products use artificial sweeteners as a marketing scheme, but what they fail to mention is that the sweeteners act as an accelerant for tooth decay. Without early treatment, decay can reach the nerves of the tooth, and the person will need a root canal or tooth extraction due to sensitivity and pain. Periodontal disease. Periodontal disease affects the gums and tissues surrounding the teeth. Chatzopoulos talks about periodontal disease in the article Smoking, Smokeless Tobacco, and Alcohol Consumption as contributing factors to periodontal disease. He says that the onset, progression, and treatment outcome of periodontal disease has been linked to smoking tobacco. Tobacco can speed up the process of infection, which not only affects a person's quality of life, but also shortens the window for early detection and treatment. Untreated periodontal disease can lead to tooth loss, gum recession, and increased risk of heart disease, stroke, and diabetes, says Dr. Kenzik. It is very important for tobacco users to go to the dentist regularly before their oral health is compromised by severe periodontal disease. In this chart that I included, you can see that bleeding is more prevalent in non-smokers with periodontal disease. This is due to tobacco reducing the blood flow. Since smokers may not experience as much bleeding, they may be more reluctant to go and get treatment until they have deep pockets. As you can see, smokers tend to have deeper periodontal pockets than non-smokers. Oral cancer. Due to its carcinogenic properties, tobacco is one of the leading causes of oral cancers. This includes cancer of the lips, cheeks, soft and hard palates, floor of the mouth, tongue, and oropharyngeal cancer. The ingredient, nitrosamine, which is found in almost all tobacco products, is turned into a major carcinogen when consumed. Due to this property, tobacco can be very dangerous, especially when consumed excessively. Untreated oral cancer can lead to a spread of cancer to other parts of the body and eventual death if left untreated. This pie graph shows the percentage of people that smoke in each of the following age groups according to Statistics Canada. As you can see, the highest percentage of people that smoke are those in the 50 to 64 age group. The Canadian Dental Association states that patients over 60 years of age are at the greatest risk of oral cancer. However, the incidence of oral cancer has increased in patients under 40 years of age, perhaps because of changing risk factors. These statistics make you wonder about the effect of tobacco use in correlation to oral cancer statistics. Here I have included the 8-step oral cancer screening process. It is smart to self-screen for oral cancer or any other signs of altered oral health. It is also wise to go to the dentist or doctor regularly for these screenings as well, and even more so if you are a tobacco user. People who use tobacco products are putting their oral health at risk. Tobacco use can lead to tooth decay, periodontal disease, and oral cancer if the right precautions are not taken. People who choose to consume tobacco products should take their oral health into much greater consideration and make sure that they are always screening their mouths for warning signs of oral health issues. If a person is willing to take part in the consumption of tobacco, they have to be willing to face the potential consequences that the product may have on their oral health. Remember, your smile reflects the choices that you make. Choose wisely. References